Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
So who should, so we're at that 4 to 6 month mark. And I totally agree. I love what you said earlier about if you're a physical therapist, reach out to the surgeon to find out if they have any restrictions. That is so important. But so the patient is 6 months post-op. Who should the patient reach out to get started with an exercise program? Do they reach out to an orthopedic surgeon? Do they reach out to a physical therapist? Do they reach out to a personal trainer? What's your opinion on that? And I know you're going to be biased, but I think you're right.
Yeah, I think I am biased, but I think reaching out to a physical therapist makes sense because we understand the path of healing after these surgical procedures. We understand that there are ups and downs and not everyone has a perfectly linear progression, but it's more like, a Looney Tunes road where it's like up, down, upside down, backwards. You know what I mean? Like a cartoon road. And then maybe when they are, as we're building up their capacity and we're building up their strength and mobility and endurance, I think when the PT feels ready to say, I think I feel comfortable with you graduating to a personal trainer if you need it, or let me give you a program that you can do on your own and we'll check in once a month. I do that all the time. I just did that today for someone. So it's like I create a mobility and a strength program. I go through it. They perform that for a month. We meet again. We make some changes. We go through it. They perform that for a month. And so it becomes this sort of monthly check-in or monthly meeting with the physical therapist. But I really do think that this population would do very well with physical therapy.
I would agree.
Or with a physical therapist, acting in that wellness, in that coaching hat, not the physical therapy hat, because they don't really need skilled physical therapy, but they still need the knowledge of a physical therapist in the wellness, strength, and mobility sphere, that corner of what we do. Because physical therapists do more than just see people after injury. We also help keep people healthy. And we can be that person that another physical therapist passes the ball to, right? So I know physical therapists here in New York, they'll be like, hey, I had this patient, they're being discharged from physical therapy, but they're climbing the Acropolis in 3 months. Would you be able to work with them? Because it's just not what they do at their clinic, And I would say then the physical therapist, you can be the coordinator, right? You can hand off to Pilates instructor, a yoga instructor, a personal trainer when appropriate, while you're still having maybe a touch point or a check-in or something like that.
All right. And I think it's important too for the patient to understand if you're at that you're at that 4-6 month mark, or maybe 3 to 4 month mark, you will probably be discharged from your physical therapy program, not maybe because you don't need more, it wouldn't help you more. It's again, most times there's insurance restrictions that are going to keep you from getting your full care. So from a patient standpoint, I think as we're talking about, exercising, starting, really trying to get back to what you're doing before you're shut down, you're going to pay out of pocket for it. I mean, it's going to reach a point to where the patient, if they want to get our skilled care, which is so much better than just going on YouTube and getting some exercises.
Yeah.
And I think the world is changing, again, not to get off topic, but I think the world is changing, that more people are seeing the value in what a PT provides and does, and they're willing to pay out of pocket because they know that that's good money spent.
Yeah.
So
yeah, I agree. And I think that's where we as a profession need to have a little more education to the public and to each of our patients when we see them. Like, listen, we do more than just rehab right after surgery. We can see the full continuum of care with those people who are really committed to their health and committed to their well-being. And I don't know about you, but I mean, I always think it's a good idea to also offer a bit of a sliding scale, because there are people who need it, and it might be a once every 2 weeks check-in.
Sure. Right.
Right? It doesn't mean 3 times a week for a year. Let's dispel that myth right away, right? Like I said, I see a patient, we check in once a month.
Yeah,
They
absolutely.
do their program, they have any questions, they know they can reach out to me, or maybe it's every 2 weeks or every 3 weeks, but it doesn't. So I don't want people to be like, "Oh my gosh, 3 times a week for a year." Like, that is not what's happening here,
Absolutely.
right?
Right. Agreed. Agreed. All right. So you have a total knee replacement and you're starting to get a little bit more progressive with your exercise. You're starting to get back to the things you want to do. Is pain okay? Is pain in that knee or pain in that hip? Is that okay as you're starting
Well,
to ramp?
yeah, I mean, what I usually tell people is I use the sort of the stoplight scenario. So if obviously zero pain, you're fine. If your pain is at like a 1, 2, 3, or 4, you're usually okay to keep pushing forward.
Mhm.
To 5, 6, or 7, I tell people we can do the exercise, but we're going to change the intensity. We're going to dial down the load a little bit, whether that's less time, less repetitions, less weight. Um, and if it's an 8, 9, or 10, then it's okay, let's stop this exercise. Let's look at what's happening with the form. Is it just too much right now? And maybe we can get back to that down the road. So that's usually what I tell people, because even if you're 3, 4 months out, like, yeah, if total knee replacement, you may get an angry knee. It may swell up after doing something too much. It doesn't mean that you stop all exercise. It's not a cease and desist. It's let's see what were we doing in that session before, and what can we change so that it doesn't put as much load onto the area that causes that kind of angry knee, because we always want a nice quiet calm knee, right?
Absolutely. Yep.
And that's kind of especially with total knee replacements, you always want to have a nice quiet calm knee. So you really have to work, and that's what those first couple of months are. You're really working hard to quiet that knee down, to get the range of motion, and so that you can actually start the strengthening process. If you have a big swollen, angry knee, it's really hard to strengthen. It's really hard to get that range of motion. And so I usually use that stop light. So green light, yellow light, red light, and patients really get that. I also say, like, if we do something and it's sore for about 24 hours and then it goes away, fine. If we're doing something, or if you're going out and you're playing pickleball for an hour and a half and you're sore for 4 days, it might have been too much, right? So it doesn't mean let's never play pickleball, but let's play for 20 minutes and see what happens instead of an hour and a half.
I think that's very true. And I also say if you have pain that's there for a week, it's not going away. So you need to call your physical therapist, or you need to call
Yeah.
whatever medical provider that you see, and you need to get that taken care of, because it's when people let that go, that's
Mm-hmm.
what will thrust them into the chronic pain cycle. And if
Right.
you want to be returned to your athletics, or whatever athlete you were before your total knee replacement or total hip shut you down, you just definitely want to avoid that chronic pain cycle. But I agree, no, everything you said. I typically say 24 hours, okay, day 3, 2, 3, 4 days, we need to be cautious and slow it down just
Mm-hmm.
a bit. But okay,
Yeah.
that's
And I find that it also really helps the patient, because then they know what their expectations are and they're not freaked out.
yeah,
Right? Because you don't want somebody to freak out and then they're sensitized, the nervous system ramps up, the volume turns up, they're very sensitized, and then every little thing um as it relates to input into their body is just amplified so much.
yeah. And that's why,
Um
like, I would, if there's any physical therapists that are listening to our podcast right now, please work in a place, whatever your setting is, but please work in a place where you can educate patients, because don't assume they don't probably know a fraction of what you know. And the more education, to me, education is power. And the more power someone has over their injury, the more in control they're going to be. So
Right.
please don't work somewhere where you're treating 4 people at a time and you have no time to educate anyone. Get into the right environment where you can treat your patients as they should be treated.
Yeah. Agreed.
Yeah, for sure. Okay, so all right, if I had $1 for every time a patient asked me this, I'd be a billionaire right now, and I would still be talking to you, Karen, but maybe I'd fly on my jet to New York
Right.
to have this live. But I'm sitting in my house in St. Louis, and so I'm not a billionaire. But so if I've had a total knee replacement, I get this more with total knees than total hips, but with total knees, can I run again? That's a big question.
Yeah. Well, number one, were you running before? Number one question to ask. And I think yes, but it's knowing that it will be a process to get you to that.
Yep.
So it means formal strength testing, right? Whether you have like a handheld dynamometer or biodex or whatever you have, but it means formal strength training. It means starting with walking, doing a very robust kind of run walk program to get you up to that. It may mean you're not running as far as you were before, and you have to be okay with that. It could be. I'm not saying that's for everyone, but it could be. So I think from the patient standpoint, it's got to be this realization that you may not be able to do the runs you were doing before, but if you just want to run and you're okay with whatever that may look like for you, because maybe it will always be like a run walk combo.
Right. Agreed. Yeah.
Maybe it'll be a mile run and you got to be okay with it.
Yeah.
But I think it really comes down to proper strengthening, strength testing, making sure that that your muscles have the capacity to hold up your body and your joints, and that you've got a good gait pattern. Because after your total knee replacement, total hip replacement, your gait's going to change. It's not going to be what it was before, usually for the better. But it's going to change. So it's going to be a little bit of education, re-educating on walking and running, and just making sure that you're not only on a good run program to progress you to full-time running, but that you're also doing a ton of strengthening.
Yeah. I've always been curious,
Quads.
and maybe I should probably ask an orthopedic surgeon this, but my take is that if you do run on that knee, I don't know, and this is my feeling. I could be totally off base, but I do think it may shorten the lifespan of that total knee.
Mm-hmm. I think that's fair. And again, I agree. You'd have to speak with the surgeon, and it depends on the age of the person getting the replacement.
Sure.
Right. I mean, I've had a friend of mine who had a total hip replacement when he was 45. So yeah, he went back to playing softball and running and all this other stuff because he's 45.
Right.
Now, will that shorten the time span of the longevity on that hip replacement? Maybe. So I think it also depends on like a whole number of factors, but age is a big one.
Yeah.
Or if you, like, I had a patient on total hip replacement because he had hip dysplasia as a child, so he had a total hip replacement when he was like 50.
Yeah.
You know?
I would also say, if you're going to return to running after total joint replacement, first of all, footwear, super important. Second of all, I would say that when you start to run, go to a good soft track, go to find a good local high school or wherever you can go that has a running track.
Right.
I think that's a really good place to start. I would avoid inclines for a period of time. So again, just like everything you've said, just kind of a gradual progression, but and I just wish that everyone would understand that. Then again, I think you said it. You may not get back to where you were before, but you can still
Yeah.
you can still be very active. And I do think you can run. I just don't know that you'll get back to those marathons. I am sure there's people out there that have had total knee
I'm
replacement
sure.
and marathons afterwards, but
I
there's,
would think they may be more the exception than the rule.
I would totally agree. Totally agree.
Yeah. And I also think, to your point of finding a softer surface, whether that's, like you said, a track, avoiding like the pavement as much as you can. But I think another important thing is, um, did you have orthotics in? Did you have custom made? Because now you have a new knee, you have a new limb. So that's another thing that you're going to have to, and that's where a physical therapist comes in. We can look at that. And then of course you want to have good monitoring of your symptoms. So again, if you get that big sort of swollen, angry knee afterwards, then okay, we need to look at, well, what is our strength? Do we really have enough strength to do this? And there are metrics for that, like limb symmetry index metrics and things like that. Are you working on plyometrics with them before they just take off and run? I think that's important as well.
Sure.
So again, that's where a physical therapist comes in versus working with a trainer, because we kind of understand the symptoms that you might be experiencing when you start something new after your replacement.
Absolutely. Wow. Well, you have shared your knowledge, and I'm greatly appreciative of this. This has been a great episode. And I know that this is going to answer a lot of questions. Look, there's questions we can't answer. It's kind of life experience, but you've done a great job. So thank you, Dr. Litzy. And I always like to end with a couple of things. First of all, I want to know, can you tell our audience what your daily mantra is? What do you live by? What word or words or phrase do you live by?
Well, I sort of choose a different word every year.
That's good.
And so this year, my word of the year was me, because I wanted to focus on my own health, physically, mentally, so that I have the capacity to take care of others. Because so often healthcare workers, especially, we give and give and give, but then we don't put anything back to ourselves. And that's the fastest way to burnout. And so I was really, this year, I'm focusing on, my word of the year is me. I know it sounds super selfish and self-serving, but it's really not. It's really making sure that I'm caring for myself and that I have the capacity to help others. So that was my sort of word of the year.
I think that's great. Dr. Dave Kittle, right? Dave Kittle. Well, I had him on as a guest a month or two ago, something of that sort. And I believe I asked him that question, and or sometime during the podcast we talked about, and he said that his own physical fitness and mental fitness is the most important thing to him, because if that's not strong for him, he can't help other people. He can't give back. So
Right.
very, very true. Very true. Okay. So what is the best way for people in the Healthy Habits for Active Aging podcast community to get in touch with you? Because I know there's going to be questions for you.
Yeah, so you can always go to my website, which is www.KarenLitzy, L-I-T as in tiger, Z as in zebra, Y.com. I'm also on Instagram at Karen Litzy and Twitter at Karen Litzy NYC.
Well, thank you so much. And audience, please reach out. Karen just has a wealth of knowledge. And again, thank you so much for being on our podcast. Thank you for sharing. And truth be told, I was blessed to be a guest on Karen's podcast.
It was a great episode.
Yeah, we talked about TMJ pain. And so I asked her if she could return the favor and be on ours. But thank you so much. As always, audience, if you have anything special for myself or for Dr. Lauren Bennett, we gave her a night off tonight. So if you have any questions, comments, maybe some tips or some ideas for future episodes, please email us at info@imovephysicaltherapy.com. We'll have another great guest in 2 weeks. We don't know what that guest is going to be, but please come back in 2 weeks. And as always, thank you so much for giving us your time. I know that life gets busy, and we are very grateful that you tune in every other week for about 30 minutes. And please, if you found this helpful, share it with someone you know that either has had or is about to have a total knee or total hip replacement, and they will be very grateful. So Thank you again, Dr. Litzy. Appreciate you and appreciate your knowledge and experience. And we'll see you all back in 2 weeks. Have a great night.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.